Next, I'd like to talk about exercises that we may do when having pain in the sitting position. I'm going to ask Stephanie to roll onto her stomach. Thank you, Stephanie. Now, the exercises that we're going to do when having pain in the sitting position will focus on encouraging some extension or lordosis of the lumbar spine. The first exercise is simply lying in what we call the prone position, lying on the stomach. Stephanie can assume this position on the living room floor. Stephanie can perform this as an exercise, maintaining this position for 15 or 30 seconds at a time, whatever's comfortable. The next step of this exercise, or the progression, would be to remain in the prone position, but propped up on the elbows. So Stephanie, I'd like for you to prop onto your elbows. She stays in the prone position, but now, as you can see, there is an increase in the curvature of the spine. So we have encouraged the lordosis of the lumbar spine, as we talked about before. Now, once again, it's important that this exercise is comfortable. So we want to maintain this position for the period of time that is comfortable to us. That may be 15 or 20 seconds, it may be 30 seconds. If you find that remaining in this position for 30 or 45 seconds is comfortable, then do so. You may want to assume this position in shorter intervals, 3 to 5 times per set, and do this perhaps a couple times a day. The next progression of this exercise will be to, again, remain in the prone position, but now pushing up onto the hands. Now this exercise is, as I said, a progression of the prior two, and may not be tolerated if you go into too much of an arch. So it's important to remain comfortable as you do this. If you have pain, I would discontinue. But once again, 15, 20 seconds or so, 3 to 5 times per set, and then return to the flat prone position. Now, the next exercise will be focused on some strengthening of these muscles of extension of the spine. Stephanie, what I'm going to ask you to do now is, while remaining in the prone position, simply raise your right leg, keeping the knee straight, and slowly return to the table. And now let's do the left side and return to the table. And what I'm going to have Stephanie do is alternate right to left, each time a nice slow contraction, up and back down. You don't necessarily need to hold, Stephanie. And we can do each side, alternating back and forth for about 3 sets of 10. Good job.